Good afternoon, Sir Kenny. I'm Leia J. Haber from BSN 1B, Group 3. For today's video, I will demonstrate to you the head and neck assessment. But first, let's define what is head and neck assessment. Head and neck assessment focused on interviewing and asking questions to determine if the patient is currently experiencing any symptoms. But first, let's identify the equipments we need. Here, we have the clean gloves, alcohol, cup of water, and of course the stethoscope and pen light.
Good afternoon, ma'am. My name is Ledger B. Haber, your student nurse from University of St. Anthony. For verification, ma'am, what's your name po? Age po?
19 po.
Birthday po, ma'am?
August 12 po.
Okay, so for today procedure, I'll be assessing your head and neck. For me to be able to assess your head and neck, I will touch your body, specifically your head and neck po. Is it okay with you, ma'am? Okay po. Before we start, ma'am, what language do you prefer po? Okay, ma'am. So, I'll start about the history po. Are there any lumps, lesions, or scars appearing in your head and neck? Okay. Is there any difficulty for you to move the head and neck po? Do you feel any pain when you're moving your neck or head po? Ma'am, nawawalan ba kayo minsan ng malay po? Okay po. Ma'am, history in head and neck injury po. Is there any injury on your head that caused you any trauma po? So, family history po, ma'am. Are there any family member that has a head and neck cancer po or migraine? Sa lifestyle po, ma'am, naninigarilyo po ba or nagsuso ng tabako? Okay. Sa pagtulog po, paano po ang posture nyo? Okay, ma'am. Next po, I'll perform the assessment na po. First, ma'am, I just, have an hand hygiene. Next po is I'll just provide privacy for the patient. Assuming that I already use a proper hand hygiene and close the curtain for patient's privacy. The next part po is I'll just use gloves. Okay, ma'am, for the first part of our assessment, I'll just inspect your face and palpate your head po. Can you remove your mask po? Okay, ma'am, I observed that your head is symmetrical, round in the middle, and normocephalic, which means your head is appropriate in your body. I also observed that there is no any lumps, lesions, or scars that I see on your head, and there is no parasites like lice. Next, ma'am, I'll be checking your facial symmetry and facial movement. Can you raise your eyebrows po? Okay, down, ma'am. Can you close your eyes po? Can you blink po? Okay. Can you pout po? Can you frown po? Okay, thank you. On your facial head po. There's no drooping on your left and right side of face. Okay, ma'am. The next part po is I'll check your temporal artery and temporomandibular joint. Can you bite po? Okay, ma'am. Next po, can you open your mouth? Okay, ma'am. As I observe po, there's no swelling or clicking in your temporomandibular joint. Okay, ma'am. Next part po, I'll be assessing your neck part po. Can you sip a bit of water po? And then hold lang po. Okay. Okay, ma'am? Can you... Sorry. Ma'am, as I observe po, your trachea is in middle line and there's no sign of bulging or swelling po. Okay, ma'am, I'll be assessing your and inspect your cervical vertebrae po. Can you look to the left side po? Right side, ma'am? Okay, ma'am, I didn't see any irregularities na nung ginawa niyo po yun. Next part po is, can you look on the ceiling po? Down po. Left side po. Okay, right side. So, ma'am, I'll be assessing your trachea po posteriorly. Ma'am, lunok po. Isa pa po? Okay. Next part po is, can you look on the left side po? Okay, ma'am. Right side po. Next one, ma'am. I'll be auscultating your neck po. Ma'am, can you breathe po? And hold. Breathe po. And hold. Hold, ma'am. Okay. As I can see po, your carotid artery are functioning well, ma'am. That's good for you. And the next part po is I'll palpate your lymph nodes. Preauricular nodes, postauricular nodes, occipital nodes, tonsillar nodes, submandibular nodes, submental nodes, superficial node, deep cervical chain node, posterior, supraclavicular node. Okay, ma'am. That's the last part of our assessment. If you have any clarifications and verifications, I can refer you to the attending physician. That's all, and thank you for your cooperation.